So coming to the next one is the treatment plans. So what are the treatments for this cancer, and also how we are going to manage. So many different type of the treatment procedures are there. So we are going to discuss one by one here. So these treatments are different type of treatments. So first one is the primary treatments, and also is adjuvant treatments. Next one is the palliative treatments. So these are the different type of the treatments. So what are the primary treatments and also secondary treatment and also adjuvant treatments. So first one is the primary treatments. The primary treatment goal is a complete removal of the cancer from the body or to kill the cancer cells. That is the important things. So what are the causative factors and also where exactly the location is there. So how to remove from the cancer cells, so from the origin site. So that is the primary treatment. So any cancer treatment can be used as the primary treatment, but the most common primary treatments are the most common type of the cancer is the surgery. So the treatment plan is for the cancer is the surgical procedure. So removal of the cancer originating tissues. So and also how much the tissue is extended. So how to remove through the surgical procedures. So that is the major surgery, like a major treatments through the surgical procedures. If the cancer is particularly sensitive to the radiation therapy or chemotherapy, may receive one of these therapies as the primary treatments. So if you see the primary treatment, three major treatments are, one is the surgical procedures and also radiation and chemotherapy. So surgical procedure means and also removal of the tissue which is involved in the cancer. So that is the one special process. And also in the chemotherapy, the special medical, like a special drugs for the cancer drugs are going to use to kill the cancer cells. And also radiation therapy also is going to send through the radiations, they are going to kill the DNA structure of the tissues, the cells of the DNA. So it may use so suddenly if you continue the radiation therapy, after some days is going to kill the DNA and also they are going to stop the growth of the cells. So these are the primary treatments, so which are the surgical procedures and chemotherapy and radiation therapy. So other than these, the primary treatments, and also we have to give the adjuvant treatments, and also next one is the palliative care. So these adjuvant treatments are going to be is kill any cancer cell that may remains after the primary treatment in order to reduce the chance of the cancer will reduce. So sometimes after the surgical procedures, after the chemotherapy and radiotherapy also, some cells may chance to develop again. So again may chance to get the cancer formations. So in these conditions, after these primary treatment, so have to continue the another treatments. So these are going to be including so these treatments can be adjuvant therapies. Common therapies are including the chemotherapy and radiation and also hormone therapy. So how to use the other treatments along with after surgical procedures. So these therapies is a similar, but is going to be used before the primary treatment in order to make primary treatment easier and more effective. So sometimes we are going to use these therapies, the adjuvant treatments therapies, so before the surgical procedures. So if they before the surgical procedures, so and also it may easy to recovery and also more effective of the primary treatments with the surgical procedures. So another one is the palliative treatments. So these palliative treatments may help to relieve the side effects of the treatments or signs and symptoms caused by the cancer itself. So sometimes during the treatments of the cancer, because of the radiation therapy or chemotherapy, so the patient will get so many side effects and also it will give the signs and symptoms. So these are going to be controlled with the palliative treatment or cured with the palliative treatments. So surgery, radiation and chemotherapy and hormone therapy can all used to relieve the symptoms. So other medications may relieve symptoms such as pain and shortness of the breath. So here, because of the radiation and chemotherapy, we'll get so many complications. So these palliative treatments are going to be helpful to improve any complications related to reduce the complications related to the cardio, like radiations as well as chemotherapy. This palliative treatment can be used at the same time as other treatments is intended to cure the cancers. So this also going to be along with the radiation therapy and chemotherapy. So these treatments are going to be helpful to reduce the complications of this chemotherapy and also radiations as well as the hormonal therapy. So what is the primary treatments? So just now which we discussed about the surgical procedures. So many different surgical procedures are going to helpful in case of the cancer management or cancer treatment. So these are going to be the goal is the main goal of the surgery is to remove the cancer as much as the cancer as possible. So for examples, so before going to the surgical procedure, the investigate like a pre-assessment or also is the examination and also assessment, a pre-operative examination and assessment will be is a more important because of how much we are going to accurately like assess the tumor and also cancer extension. So according to the extensions, I have to do the surgical procedure. So while doing the surgical procedure, sometimes may affect to the vital organs, or in case of sometimes it's not possible to do the surgical procedure until the extension of the cancer. So in those conditions, have to take some precautionary measures and also some other like a treatment techniques how to use. So that's the things. So we have to know about the exact what type of the treatment, what type of surgical procedures have to do for the according to the involvement of the tissue and also site. So this surgery is going to be not only for the treatment purpose and also during the we are going to do the surgery like an investigation process, diagnostic procedures. So just now we discussed about the regarding the biopsies. If you want to remove, if you want to get the sample, so and also we are going to open the structure and also we are going to cut the small piece for the sample and also for the investigation procedure also. That's that type of surgical procedure is called as the biopsies. So here we are going to take out the small piece of the tissues, for example, in case of any bone cancer. So if you want to biopsy, so we have to open the bone tissues and also have to take the small piece of the bone tissue. Then we can do the that the procedure is called biopsy. So there we can do the histopathological lab, identify the pathological abnormalities and rule out the cause to fact and rule out the type of the cancer. Then we can do the treatment procedure according to the a condition, according to the tumor cancer type. And also this diagnosis is made by looking at the cells from the sample with a microscope by doing other lab test on it. So along with this biopsy test and physical examination and some other like a tumor markers, so which we discussed in the last class, and also the what type of the special test for the like a different type of the cancers. Okay, for example, in case of the cancer, like a lung cancer, so the the tumor markers are different, the special tests are there. Or in case of already having some breast cancer, the tumor markers, the different tests are there. Tumor markers are nothing but different of special tests for the different type of the cancer diagnosis. So this procedure, everything is called as biopsy. So these biopsy taken during surgery are often referred to the surgical biopsies. So during the surgeries, if they take the small piece of the tissues, so for the investigation procedures, so this type of surgeries are called as surgical biopsies. So and also these surgical biopsies are going to be the open surgical biopsies and also is a microscopic or arthroscopic. They're going to take the small piece are also and also how a sample is taken depends upon the where the tumor and what type of the cancer is suspect. So it's going to be totally different. For example, depends upon the involvement of the structure, the biopsies, the procedures will be different. For example, method used for the prostate biopsy is different from those used for the lung biopsies. Because the structure is different and also the way of the pattern, the way of the method also is going to be different for the surgical biopsies. So another treatment plan is the surgical procedure that is also called as the cryosurgeries. Cryosurgeries are nothing but cryo means like cool. So it's going to give the like a cool treatment or nothing freezing treatment. So here cryosurgery is a type of the treatment in which the extreme cold produced by the liquid nitrogen. So this is going to be this and also argon gas is used to destroy the abnormal tissue. So it's going to the liquid nitrogen and also argon gas is going to use to destroy the abnormal cells or abnormal tissues. So where the tumor and cancer is there. So this liquid nitrogen and also argon gas is going to destroying the cancer tissues. So this cryosurgery may be used to treat the early stage of the skin cancer, retinoblastoma, and also is pre-cancerous growth of the skin and also cervix. So this type of surgical procedures, so this also going to, they are going to use the like a liquid nitrogen and also argon gas, especially for the pre-cancerous growth development of the skin and cervix conditions. And in case of the some early stage of the cancers and retinoblastomas, so these conditions are going to treated with the cryosurgeries. So cryotherapy are also called as the cryosurgeries in the surgical procedure. But in another terminology, who are doing okay, cryotherapy also nothing but if anybody get any treatment with the cool treatment or like ice therapy, in case of rehabilitations, in physiotherapy management also. So this treatment method is available. So who are got the any like a muscle tightness and swelling or because of the edema. So this cryotherapy also going to be and also they're going to use to reduce the pain and swelling. So application of the this ice therapy in the different procedures. So they are going to use some different methods such as whirlpool bath method, is a direct contact method, ice applications, and also immersion method. So they're going to put the like a limb in the ice water and also with ice therapy. So the treatment is different, but here is going to the surgical method. So in the surgical procedure is to destroy the tissue, abnormal tissue with the freezing with liquid nitrogen and also argon gas. And also another treatment is the laser surgeries. So these laser surgeries are going to be is a powerful beam, and also these lights are going to use to cut through the tissues. So these laser lights are going to use during the tissue like resections, the tissue cut. So during the surgical procedures. So these lasers can focus very accurately in tiny areas, so they can be used precise surgeries. So because of these surgical procedures, even all the cells we have to remove from the involved structures. So sometimes, so because of this different type of the knives, so cannot detect, or sometimes we cannot clear all the affected cells. Or maybe if you take more than that extension part, it may affect the other structures also. So in those conditions, if you want to accurately remove the structures, so with the help of the lasers is possible. So this is going to give the accurate dissections, accurate cuts while during the surgical procedures. And also this also going to be used to shrinken or destroy the tumors or growth might into the cancers. So during the pre-cancerous conditions, this lasers also going to be useful to destroy the tissues or shrinken the tissues. So if we apply the application of these laser tissues, so sorry, laser this rays, so we are going to destroy the tissues. And also these are going to be used to treat the tumors on the surface of the bodies, especially the body on inside the linings of the internal organs, or any cavities or any epithelium is going to be involved. So any cavity formations, so there is going to get we are going to use the laser therapies. So in case of is a basal cell carcinoma and also cervical changes might turn into the cancer, or the cervical, vaginal, esophageal, and also non-small lung cell cancers. In those conditions, so these lasers treatments are going to be useful to destroy the abnormal cells and also to shrinken this abnormal tissue growth. So that is about the surgical and laser surgical procedures. And also in the another surgical procedure is a hyperthermia. So this hyperthermia is a type of the treatment in which the small areas of the body tissues are exposed to the high temperatures. So where the abnormal tissues occurs, so is going to be exposed to the high temperature. So if because of the high temperature is going to damage and kill the cancer cells, and to make them more sensitive to the radiations and certain chemotherapy drugs. So this radiofrequency ablation is one of the type of the hyperthermia that uses the high energy radio waves to generate the heat. So this like a radiofrequency ablations. So if we give the high percentage of the heat, so because of this high percentage of the heat is going to be damage the abnormal tissues, so it kill and also if they produce the high heat, so it's going to be more response to if we give any chemotherapy and also radio frequency. So these radio frequencies are going to be is a one type of the hyperthermia. So this is nothing but is another in a part of the hyperthermia treatments. And also next one is a photodynamic therapy. These are also treatments that uses the drugs which react with a certain type of the lights. So they're going to give the drugs to the particular light. So when the tumor is exposed to the light, so these drugs become active and kill nearby the cancer cells. So because of this photodynamic, the light is going to be is an effect on the abnormal tissues. So these photodynamic therapies is most in the treatment of symptoms caused by the skin cancer, is a mycosis and also fungidocytes, as non-small cells cancer, lung cancers. So especially in the cancers, or maybe these photolights such as like a UV or ultraviolet rays, like, and also along with some medications. So these phototherapies or photodynamic therapies helps in the case of the skin cancer, most commonly in the skin cancers, and also mycosis and fungoides, and also non-small cell lung cancer. So in these conditions, this photodynamic therapy is going to be more useful. So these are the treatments of the surgical managements. So, and also these surgical procedures are going to be different type of surgical procedures. So either so open surgeries and also is a minimally invasive surgeries. So these surgeries also. So these open surgeries are going to be makes the surgeon makes one large cut to remove the tumor. So they're going to, if any like a benign tumor or malignant tumor. So if the structure is there, so surgeons are going to be opening the structure and going to take out and remove the whole like a structure. And also maybe sometimes they have to take by nearby the lymph nodes, any lymphatic system involvement. So how to remove the lymph nodes together in case of the open surgeries. And in case of the minimally invasive surgeries, so these minimally invasive surgeries, they're not going to open completely. They're going to put into a small cut. So they're going to do with the small cuts instead of the large one. So here they're going to insert the long tube, thin tube, and also small camera into the small cut. So this is called the laparoscope. The small tube is going to insert it into the cut area. So there's this camera is going to give where they're having the abnormal tissue growth, and also that has to remove with the help of this video camera. So this surgical procedure is called minimally invasive surgeries. So here they are not going to stay prolonged time in the hospitals, and also discharge also going to be very easy. So here surgeons are uses the special surgery tools that are inserted through the small cuts and remove the tumor, and also some healthy tissues also along. Sometimes because of, if you want to remove the whole like all the affected tissues, sometimes we have to take out the healthy tissues also, because if we leave one small abnormal cell also, again it's going to be multiply and divide, again may chance to get the formation development of the cancer cells. So that's the reasons. So sometimes the surgeon has to take the decisions how to take along with the affected part along with the healthy part. So because of minimal invasive surgery requires a small cut, it takes a less time to recover from then the open surgeries. So that has the advantage of the open surgeries and also the difference between the minimal invasive surgeries. But in case of the extension is more, so in those conditions have to do the open surgeries if the tissue or if the any tumor size is increased. So in those conditions have to do the open surgeries. It cannot be not possible through the minimal invasive surgeries. So this depends upon the type of the surgical procedures. So the effect will be different, and also some surgeries are going to remove the entire tumors. So here the surgery removes cancer that contain the one area, as maybe the stomach, complete stomach involvement, or maybe liver or pancreas. So they're going to remove the entire part of the involved structure. So, and also sometimes have to remove the only some areas of the structures. So that is called the debulk a tumor. So in this one, the surgery removes some or but not all of the cancer tumor. So it's not going, only part of the organ is going to be removed. So debulking is used when the removing the entire tumor might damage an organ or body. So sometimes if you remove the whole like affected part, so it may affect the surrounding structures or maybe organs. So in those conditions, should not remove the whole like involved structures. So that type of surgical procedure is called as debulking methods. So removing the part of the tumors can help other treatments work better. So what is the importance of this debulk of tumor is, so if you give along with this debulk methods, these surgical procedures, so it also is helpful for the chemotherapy as well as the radiation therapy. So it will helpful and also easier to reduce the complications. And also the surgery also important to use to remove the tumors that are causing the pain or pressure. So in case of like in the benign tumors, so it's going to be like a space occupying in the tissues. So in the space occupying lesions, so it increasing the pressure. So these surgical procedures, if you remove the tissue growth, so we are going to reduce the pressure, so we are going to reduce the pain. So that is the mechanism of the surgical procedures. So that is about the surgical procedures. So until now we discuss about the different type of the surgical procedures. So the surgical, what are the types of surgical procedure, open surgery and also minimal invasive surgeries and also cryosurgeries, laser surgeries. So these are the different type of methods and treatment plans in the cancer treatment.